Weekly Checkup, brought to you by Dignity Health Central Coast.
There are 21 discs in the human spine, and over time, those discs naturally age and degenerate. Dr. Rocco Calderon at St. John's Hospital says in some people, that leads to an inability to perform normal activities.
The majority of the population will experience back pain at one time in their lives. Initially, exercise is the best treatment for the lower back. Beyond that, medications can help, including anti-inflammatory medications. When it gets to the point where nothing is helping, that's when we start looking at options that include injections and other alternatives.
Patients who have lower back pain that doesn't respond to conservative treatments may be candidates for disc replacement surgery.
The goal is to return to a pain-free state where they can perform any activity that they were performing before without pain or limitation in motion. The surgery for disc replacement, whether it be in the neck or lower back, involves a small incision and exposure of the spine from the front. The degenerated disc is removed, and then that is replaced with a disc replacement that restores the height and mobility of that segment. The recovery from that procedure is pretty quick. Within 2 or 3 weeks, the patient is back to normal activities of daily living. By 6 or 8 weeks, they're back into regular routine exercises that they had performed before.
For more information, visit dignityhealth.org/Central Coast.
Weekly Checkup, brought to you by Dignity Health Central Coast.